G'day guys, Sam here from We Train You. I'm just here to show you today how to do CPR on an adult mannequin, okay? The main things you need to know with an adult mannequin is that you need to use two hands to do effective compressions to get effective depth. When you push the chest, you need to press the chest 1/3 of the chest, and you need to do a full head tilt or jaw thrust to get an adequate airway to ensure that you get ventilations into the lungs, okay, to make the chest rise, okay. The key with CPR is that we push hard and we blow gently, okay. We need to push blood all the way around the body, perfuse the body, and we blow just enough to make the chest move. You don't need to blow hard, and we never want you to overblow. Blowing too hard can actually make them regurgitate. What we first want to do is just assess the patient to make sure that we are doing the right thing. We're going to run through the doctors A, B, C, D, okay? And there's two assessments in there. So R is for assessment and B is for breathing. So are they conscious? Are they responsive? And are they breathing? Are they breathing sufficiently? Okay? For response, I'm just going to run you through a test. Then for breaths, we actually want them to breathe twice in 10 seconds. If they don't breathe twice in 10 seconds, they are not oxygenating sufficiently, and we haven't been able to wake them up, so we then proceed to do CPR. Okay, so it looks like this. Hello? Can you hear me? Can you hear me? Can you open your eyes? Hello? Can you tell me your name? Hello? What's your name? Can you squeeze my hands? Okay. If we're not happy with the level of response, it's time for someone to call for help. So you can either send someone for help, or dial 112 from your mobile, put it on speakerphone, and keep talking to them, have them talk to you. They will ask you the status of the patient. Okay, we've assessed that they are unresponsive or we're not happy with the level of response. Help is then going to come its way. Now, airway. Palm on the forehead, two fingers on the jaw, and we're going to tilt that head all the way back. For an adult, it really is quite a big head tilt. The jaw bone there, the chin wants to be the highest part of the body, okay? All right, we're gonna put our hand on the chest, arm laying on the diaphragm, and ear goes right down touching the nose so that you can listen and feel, okay? We're gonna look at the chest, listen and feel, and count 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. They are not breathing, so we tell the patient to tell the phone operator that, and we then slide two fingers up the rib cage and find the bottom of the sternum. Do it on yourself, okay, and find that. And we can put the heel of the hand on top of those two fingers, okay? So we then have the heel of our hand on the lower third of the sternum, okay? We then need our arm to be locked straight, the shoulder directly above the heel of the hand. For an adult, we need two hands, so we're going to put our other hand on top, and again, arms locked straight, shoulders directly above the sternum. And we're going to do 30 compressions, keeping a nice regular rhythm, okay? It's 100 compressions a minute, 30 compressions before we come on to our two breaths. And it looks like this. Palm back on the forehead, pinch the nose this time to seal the airway, okay? And we're just going to be able to put your mouth all the way around to form a seal, and the objective is to make this chest just move, okay? So, look down the chest in between, make sure the chest has fallen, and go again. Now you need to maintain this until they either recover, paramedics turn up, or you're too exhausted to continue. Or if you have a defib come along, the defib comes on and the defib tells you to stop doing compressions because it wants to analyze the patient. Okay? Hope that helps, guys. Hey guys, this is Sam from We Train You. I hope you like the videos. Just here to let you know, we're a first aid training company based in Fremantle, Western Australia. We've been training your teachers and your daycare workers and people in local businesses for 4 years now. I'm a trainer with 14 years experience. My wife is a nurse with 14 years experience who's also one of our trainers, and all of our trainers are either senior nurses and or paramedics, okay? We come out to your business, so you can hire us for a day to come out and train all your staff. We need a minimum of 6 people. We'll bring the mannequins and the AED trainers and the puffers and the spacers and the EpiPens and the bandages, and we'll show you how to look after each other. We're also now running public courses in Little Creatures in Fremantle. Creatures have kindly allowed us to use their Red Room, which is the next door bar upstairs, and we can start doing public courses there. We're going to start doing them the first Saturday of every month, and then just see if they're popular enough that we can make this a regular thing for the Fremantle community. So we're going to start running first aid courses in Fremantle. Please go to our website. It's www.wetrainyou.com.au. On there you can find all the information about our courses, the different codes to make sure they match your industry. You can also find our fully WorkSafe compliant first aid kits that we distribute, and AEDs, which can also benefit anyone in the community. We are also trying to get a lot more AEDs out in the community so that people will know where they are and can use them in the event of any sudden cardiac arrest. Okay? Please go on the site, please feel free to drop us a line. Email is the best, because if we're out training we can't answer the phone, and we do get back to you at the end of every working day. We really just want to get out and train more people, so there's more people out in the Fremantle and Perth community who can save a life. Okay, thanks very much.